Welcome, everyone. Our question of interest today is whether yoga can be used as an effective treatment for chronic low back pain when compared to traditional exercise methods for women aged 40 to 50. By the end of this presentation, our learners should be able to name 3 common causes of chronic low back pain and also list 3 benefits of yoga compared to traditional exercise methods. So, how many people here have ever had low back pain before? Wow, great. Looks like a lot of you have been suffering from this. Now, how many of you have tried yoga before? Okay, not as many. Good. Now, here's a question. I'll give you a couple of minutes, maybe 1 or 2 minutes, to talk with the person next to you and discuss options of this. Okay, great. So, now we're going to talk about low back pain. What is low back pain? Low back pain is one of the most common causes of disability and lost sick days in our society today. Over 85% of the population will have at least one episode of low back pain in their lifetime. Now, while some common causes of low back pain are easy to identify and diagnose, conditions of chronic low back pain are often more difficult. Common diagnoses for more acute low back pain are fractures related to trauma, soft tissue injury, or nerve root compression. Now, chronic causes deal more with sometimes somatic pain, which means that it's all sort of just imagined pain, or stress and lifestyle factors have a big influence. Other causes, ligament abnormalities of the intervertebral joints, wasting or weakness of spinal muscles, and local nociceptor stimulation, nociceptors being your pain receptors. Now, low back pain is usually treated with Western style medicine, so biomechanical adjustments, pain medication, mobilization and manipulation techniques, and also traditional exercise therapy, which includes strengthening, stability, and stretching exercises. So, what is yoga? Yoga literally translates into the union between polarities. Now, while the Western world may associate yoga with more of a physical workout related to weight loss issues and things like that, traditionally this is incorrect. The flow of postures, or asanas, are only a very, very small part of traditional yoga. Yoga is a holistic practice that encompasses many aspects aside from the postures, including the philosophy or history, pranayama, which are breathing exercises, dhyana, which is a meditation, other things including chanting and chakras, and the flow of prana, which is energy. Now, while only a small part of yoga, postures do have a benefit for the physical body, including increased flexibility and strength, increased bone health and strength, improved blood and lymph circulation, and stimulation of the central nervous system, as well as creating a still, peaceful mind, which helps to reduce stress.
Hi, I am a researcher. I wrote the study, The Effect of Short-Term Intensive Yoga Program on Pain, Functional Disability, and Spinal Flexibility in Chronic Lower Back Pain, a randomized control study. My study wanted to figure out the effect of a 1-week intensive residential yoga program, which was the intervention, with a physical exercise program, the control, on pain and spinal flexibility in subjects with chronic lower back pain. There were 80 participants involved in this study, with slightly more males than females, and their average age was 48 to 49. The length of time that the participants had dealt with chronic lower back pain were from under a year to over 10 years, and these patients couldn't be severely obese. Then, the participants were randomly allocated to 2 groups. The control group, in which the participants did daily sets of exercise, physical movements, as well as non-yogic, safe breathing exercises and lectures on scientific information for 1 week every day. And then we had the intervention group, in which participants did daily intensive yoga programs, including meditation, yogic hymns, lectures, and yogic physical exercises and poses for 1 week every day. So as you can see, the results were for the yoga group went from moderate to mild disability scores, and the control group didn't really have a significant difference. So, and as well, just to note, spinal flexion increased for both groups, but more for the yoga group. So in conclusion, the study showed that a short-term intensive yoga program can increase spinal flexibility and decrease chronic lower back pain. However, there needs to be a follow-up study that tests to see the long-term effects of the short-term intervention.
Hi, I'm Karen Sherman. My colleagues and I compared yoga, exercise, and a self-care book for chronic low back pain. In our study, we aimed to find the best treatment for chronic low back pain out of a yoga, therapeutic exercise, and a self-care book treatment. So the subjects in our study were 101 men and women randomly selected. The majority was women between 40 and 50 years. All the patients previously had chronic low back pain, and they had been suffering from this within the previous 15 months of the study. Alright, so in the study there was 3 groups, a yoga group, exercise group, and the group given the self-care book. The whole study was 12 weeks in duration, and the goal of each group was to minimize chronic low back pain. So the whole study was 12 weeks. 14 weeks after the intervention, we followed up and found that the yoga group was still benefiting from the results. After the intervention, the book and exercise groups actually had worsening symptoms. This alludes to long-term effects as yoga as a treatment for chronic low back pain. In conclusion, our study shows that yoga can be a beneficial treatment for patients with chronic low back pain.
Hi, I'm Professor Wormgore, PhD, MD, ABC. My colleagues and I looked at the impact of aerobic fitness on functioning in people with chronic back pain. For our study, 94 subjects were selected, all within a certain urban population in Norway, and they had to pass at least 8 weeks in sick listing back pain as their dominating symptom. We took these subjects, and within them we took one group that was randomly selected to be our control group and one to be our treatment group that underwent an intensive 3-week aerobic fitness training program. We took measures at baseline, at 3 weeks after the program, and 6 months after the program as well. Measures of aerobic fitness, lumbar spine function, pain intensity, body functioning, and structure were taken at each of these intervals. So for results, we found, of course, at baseline, aerobic fitness was reduced in most subjects due to back pain, but increased significantly following intervention. We also found pain intensity decreased, body functioning, activity performance measures, and social well-being at work increased following intervention. However, we're looking at 3 years after the study, an average 30% of people with chronic back pain were still sick listed or permanently disabled. So to conclude, we found that the improvement of aerobic fitness seems of limited value as the goal of a treatment outcome for patients with chronic back pain.
So, now back to Sally. Has the evidence shown that yoga is a valid option to consider with low back pain?
Yes!
Yeah, you got it! Yoga can be a great option, but remember, not all yoga is the same. Community classes are more geared towards a physical workout, whereas more relaxation types are probably more helpful for chronic low back pain. So, in summary, remember that increasing aerobic fitness alone does not improve low back pain. Muscle strength and flexibility are needed, which is done with exercise therapy and yoga. However, yoga exceeds exercise therapy because it improves stress. So a final thought, namaste.